Hi, my name is Justine Evans, and I'm going to explain to you how to use the MenoCheck menopause test to see whether you are perimenopausal or menopause has occurred. Menopause is the permanent cessation of menstruation, but is not usually scientifically diagnosed until 1 year after a woman's menstrual periods have stopped. The period leading up to menopause and the 12 months following is known as perimenopause. Many women experience symptoms during this time, including hot flushes, irregular menstrual cycles, sleep disorders, vaginal dryness, hair loss, anxiety and mood swings, short-term memory loss, and fatigue. The onset of perimenopause is caused by changes in the level of hormones in the female body that regulate the menstrual cycle. As the body produces less and less estrogen, it increases the production of FSH, follicle stimulating hormone, which normally regulates the development of female eggs. Therefore, testing for FSH can help determine whether you're in the perimenopausal stage, and if so, you can take the appropriate steps to keep your body healthy and avoid health risks associated with menopause, which include osteoporosis, increased blood pressure and cholesterol, and increased risk of heart disease. The test utilizes a combination of antibodies, including monoclonal anti-FSH antibody to selectively detect elevated levels of FSH. In the kit, there are 2 tests, 1 instruction leaflet. The process is simple. At home, it is quite simple to do the test on yourself. When to start testing. If you're still having monthly periods, then the first test should be taken during the first week of your menstrual cycle, days 2 to 7, with day 1 being the first day of your menstruation. Then repeat the second test 1 week later. If you're no longer having regular periods, the first test should be taken at any time during the month and the second test 1 week later. How to use the test. Firstly, determine the day to begin testing. Allow the test and urine specimen to reach room temperature, i.e. between 15 and 30 degrees Celsius prior to testing. The urine specimen must be collected in a clean, dry container. A first morning urine specimen is preferred since it usually contains the highest concentration of FSH. However, urine specimens collected at any time of the day can be used. Bring the pouch to room temperature before using it. Remove the test midstream from the sealed pouch and use it within 1 hour. Remove the cap. Hold the midstream test with the tester pointing downward directly into the urine stream for at least 15 seconds until it is thoroughly wet. Don't urinate on the test and control window. If you prefer, you can urinate in a clean, dry container and then dip the absorbent tip of the midstream test into the urine for 15 seconds. After removing the midstream test from your urine, immediately replace the cap over the absorbent tip, lay the midstream test flat on the surface with the test and control window facing upwards, then begin timing for 3 minutes. As the test begins to work, you may notice a light-coloured flow moving across the test and control window. Read the test at 3 minutes. If no result appears, wait 1 minute longer. Do not read results after 10 minutes. We are now going to interpret the results. If the result is positive, 2 lines are visible, and the line in the test line T is the same or is darker as the line in the control line C region. A positive result means the FSH level is higher than normal. Record the results and see the chart to interpret results. If the result is negative, 2 lines are visible, but the line in the test line T is lighter than the line in the control line C region, and there is no line in the test line region T. A negative result means the FSH levels are not elevated at this time. Record results and see the chart to interpret results. If the result was invalid, the control line C would have failed to appear, or 1 coloured line would have appeared in the test region T. This is likely to be caused due to insufficient specimen volume or an incorrect procedural technique has been used. Review your procedure and repeat the test with a new test. Review the results of both tests taken 1 week apart and interpret according the following to this chart. If you are experiencing menopausal symptoms and have had no menstrual cycle for the last 12 months and your first test is positive, menopause has likely occurred. This test may be repeated. Discuss with your doctor methods and therapies to promote good health after menopause. If you have any further questions on using this test, contact the pharmacist where you purchased your test from or contact Smith Biomed at info@smithbiomed.com.